Hello and welcome everybody, and thank you very much for joining us for this Health Pathways information session. My name is Sandy Vincent. I'm from the PHN education team and I'll be facilitating today's session. I'd like to start today by acknowledging the traditional custodians of the land that we live and work on. Today I'm in Darkinjung land and pay my respects to their continuing culture and contributions to the life of this great region. Before I introduce our speakers, I just have a few things that I wanted to let you know. This session is being recorded. The recording and the PDF slides will become available on the PHN website in our education library within the next few days. Your cameras is automatically disabled for all attendees and your microphone is turned off. But if you do want to ask questions or comments, then please just use the question box in the panel and I'll direct those to our presenters today. At the end, an evaluation survey will come out to you directly. We ask that you do complete that. That information is really helpful for us. We have three presenters from the PHN today. Amanda Martin is the Manager for PHN Commissioning Services. And then you're going to be hearing from Erica Drew from Central Coast Health Pathways and Evan Morris from Hunter New England Health Pathways. So I'll pass over to our presenters. Thank you. Thanks, Amanda.
Thanks, Sandy, and welcome everyone. So today we're just going to have a very quick overview of Health Pathways and how it is relevant to commission services. Because as you will know, the Health Pathways and the requirement to use Health Pathways is a key part of our contract and their standard terms and conditions. So Erica and Evan will go through today using the platform as well as how you can interact with the platform to ensure that you keep your your organisation's referral details up to date and are able to then adhere to the standard terms and conditions of the contract that you're operating under. So with that, I'll pass over to Evan, who will go through the slides and take you through the Health Pathways platform. Thanks, Evan.
Thanks, Amanda, and thanks, Sandy, and good afternoon. A very warm welcome to everyone that's joining us today. I'm coming to you from Gunnedah, out near Tamworth, in the New England region, and Erica is joining us from our Erina down on the Central Coast. Today we're going to have a look. We're going to have some time at the end for questions. No doubt you may have some as we go through. We're going to have a look at what is Health Pathways, what does the team look like, what is a pathway and how are they developed, but then more importantly look at some of our referral information and the information that you as service providers can put into Health Pathways so people are aware of your service and how to refer into that. So the information that's on your screen at the moment, that is the login details, and we are going to share these slides with you afterwards. So we do have some light security on Health Pathways itself, and that's because it is a clinical tool in a sense, designed for clinicians to access. But we also have patient information as well, which is more freely available, and there's no username or password required for that. We do have two sites, one for the Hunter New England area and one for the Central Coast, and that's just because we have a different dynamic of services and clinicians and different arrangements in place. So, but you can potentially access both to see services that are available. So, what is Health Pathways, and what's the purpose of it? Primarily, we look to improve care between primary, secondary, and tertiary services. It's an online decision support tool. It's accessed via a web browser. It doesn't require any software installation. And importantly, we sit down with subject matter experts, clinicians, locally agreed information, how to assess, manage, and refer patients to local services, and who provides what, when, and where and how with regards to those services. And we could be talking about a whole range of different topics. So, you know, it could be something like COVID vaccine procedure, it could be diabetes, National Disability Insurance Scheme, drought support, or psychosocial support. And more broadly, we're also part of a community. So this isn't something that's just happening in the Central Coast and the Hunter New England region. It's happening right around Australia and New Zealand. And many of these regions have health pathways programs in place, and we have the capacity to share that information with the intent of standardising the patient experience, not just within our own regions, but more broadly as well. We have partnerships in place between the primary health network and the local health districts, and that gives us the ability to work with different subject matter experts to develop the pathways. And it was originally developed in New Zealand, and it's spread across both islands, and it's now actively used across 33 regions in Australia. We've been at this for close to 9 years now, and we have over 300 clinical pathways spread across the regions, and multiple referral pages supporting those clinical pathways. I'll just hand over to Erica to go through the next few slides.
Thanks, Evan. So this is kind of a visual representation for you of the complexity of the health system. And so the purpose of Health Pathways is in partnership with the local health districts and allied health, nursing, non-government organisations, commissioned providers, non-government charities, and so on. We want to see the local system as a whole of system approach. So in both Hunter New England and in Central Coast, the Health Pathways approach is for a whole of region approach, seeing all providers and all sectors as a one system rather than silos and segmented services. So that's how we we're aiming for this kind of utopia, I guess, where we can connect through Health Pathways the sectors and help communication and the patient journey through one health system. All right, next slide, Evan, thank you. So yeah, just a bit more about the platform. So the Health Pathways platform is dynamic. It's easily updated by our respective teams, and it's very accessible for health and social care professionals in the regions. So if you haven't accessed it before, we provided the login details earlier, and you can always send a request for access as well if you forget those login details, and then you have access to the full suite of information that's on the Health Pathways website. It's designed to provide really clear, concise information and resources so that it's really quick and easy for you to use, and you can find the information that you need really quickly. And we are continually updating pathways. So we work in partnership with lots of different providers and clinicians to develop new pathways, update existing pathways, and that can be for a variety of reasons. It could be changing evidence, new technologies, guideline changes, local circumstances might change. There might be a new model of care that's implemented, or new services that become available. So we're constantly working to update and add new information into the Health Pathways sites. So Evan and I thought it was a good idea just to show you, I guess, the breadth of collaboration that's involved in Health Pathways. So we work with a variety of different clinicians and managers and health professionals. So we work with subject matter experts and reviewers in our communities. So that could be specialists, nurses, allied health professionals, managers of services. And then in our teams, we have clinical leads, we have clinical editors, we have the program team members, of which Evan and myself are members of the program teams. And then we also work in partnership with a New Zealand organisation called Streamliners, who were the original I guess, support organisation that worked with Canterbury District Health Board to create the concept of Health Pathways. And they work on the hosting, the online components, and the technical sort of aspects. And then down the bottom there, you can see a screen capture of what the send feedback button looks like on both sites. And so you as users, when you're using the site, you are welcome to use the send feedback button, which appears on every page on Health Pathways. And if there's anything that you see that needs updating or revising, you can send us a feedback. It's sort of like an email, and that sends through to the program team at the relevant Health Pathways site, and then we will follow up on that depending on what the information is. If it's clinical, that will be addressed by our clinical editors, or if it's something straightforward like a phone number update, that can be addressed by our program team members, and then we make changes to the websites, and that's reflected on our sites. And there's a reasonably quick turnaround time when there's urgent information that needs to change. Okay, so in terms of the clinical pathways, Evan, was this one that I needed to cover? Yes, I think it was.
Yeah,
so
if you're going to do that one,
we're
then I was
just
going to
going
talk
to
to the
swap
referral
between
page.
both. Yeah, we're going to swap between both of us, so I'm just keeping on track of who's doing which section. So clinical pathways in the Health Pathways sites all have the same structure. So you can see there, hopefully it's clear for you. It's a little bit hard to see because it's a lot of information that we're trying to show on the slides, but clinical pathways will always have the structure of assessment, management, and referral. So a lot of the clinical content will obviously be in the assessment and management sections, and you can see each of those arrows are drop-down boxes. So when you click on those, they're hyperlinked, and they'll expand a drop-down box with more details in there for you. And the reason for those is to try and keep the pathways somewhat concise, and then you can quickly navigate to what information you're trying to find, because the primary purpose of Health Pathways is that clinicians can use it while they're in a consult with patients. And then the referral information, that will be linked to either drop-downs where the referral information will be embedded, or they'll be hyperlinks to referral pages, and it will take you straight to that referral page. All right, thanks, Evan. Next slide.
Thanks, Erica. Yeah, the next one's referral, so I'll go from there. Just before I move on to the next slide, all of the information that you can see in the left-hand table of contents on that slide, they're all clinical pathways for the most part. So things like bereavement, bipolar disorder, eating disorders in children, problem gambling, suicide ideation and intent, they're all what we call the clinical pathways. You can see that this particular one we've highlighted, which is the social isolation and loneliness pathway. You can see, as Eric has alluded to, the assessment and the management. So what is the GP doing, in the community? But then once we get down to this referral section where it says connect the patients to existing resources, you can see that we have a wide variety of referral breakout points that are linked to this particular clinical pathway. And that's because all of those may be related back to the reason that the person is there, and that could be that it's parenting support, dementia, bereavement, transgender health and gender diversity, perinatal, drug and alcohol, etc. And then what we try to do is provide as many of the referral pages to the clinical pathways that we can, and then we list public, private, NGO services, etc., for the relevant regions in those referral pages. And this is what a referral page will typically look like. What you're looking at now is one for the Hunter New England region. Geographically, it is a very large region, and for that we have split up and tried to categorize, I guess, into large, not necessarily LGA areas, but things like the Lower Hunter, the Upper Hunter, the Manning Great Lakes Taree, and the New England Northwest. And then we've grouped services respectively into those areas. You can obviously look in all of the other regions, you know, because the services may simply not be available. If you're in Tenterfield, for example, or you're in Cessnock, obviously, depending on where you are, will depend on what services are available. But generally speaking, this is what a referral page will look like. And where possible, we try to group our referral pages all together. So on the left-hand side, again, on the table of contents, you can see that this is the non-clinical community mental health. So this is a lot of our psychosocial support services. But in here, under this referral section, we've also got other referral pages like mental health dietitians, eating disorder support, and so on and so forth. So when you expand one of those regions, this is what it looks like, and this is where information that you may have provided to us as one of the commission services, this is where we will list that information. So generally, we will list it in one of two ways. Detailed, like what you're seeing here, where we might provide an overview of your service. We might list criteria, exclusions, things like that, how to refer. The other way is where it might just be a simple list, for example. So it could be a list of occupational therapy driving assessment providers, where we simply list, you know, the name of the provider, their address, and how to get in contact with them. And this is the Central Coast equivalent of a referral page. And you can see that this is their psychosocial page, and you can click on this, which will actually give you a drop down of all of the services available in the Central Coast region. I'm just going to hand back to Erica for how to best, when you're accessing Health Pathways, how to best search for your information and how to keep that up to date. Thanks, Erica.
Thanks, Evan. So yeah, we wanted to give a really sort of clear example of how you can use Health Pathways to benefit you as a commissioned service provider. So one of the easiest ways to find your information, and probably the best way we think and the quickest way for you, will be to use the search function, which appears at the top of each page on both regions' websites. So it should look the same for you no matter which region you provide services in. And you can actually search for keywords, so topic areas in terms of, say, bipolar disorder, for example, but you can also search for your actual service name or your organisation name. So we think probably the better option for you to use it to find things really quickly is to use your service name. So I've just given an example there of Lifeline on the Central Coast Health Pathways website. So in the search function, it brings up this list of search results. So Lifeline is appearing on each of those pages. And when you're in the website, if you click on any of those, that'll take you directly to that page. So just pop to the next slide, Evan, and then we'll explain. Once you get onto one of those pages, this is the process for how you can quickly find your service information. So when you're actually on one of the pages, if you actually use the toolbar on the right-hand side, if it's visible for you, it'll be a full-length toolbar on the right-hand side of your screen. But if it's not popped out, just use the blue and white plus button, which is at the top right, and that will then pop out that toolbar for you. Then on that toolbar, you click on the Expand All button. So then, once that's done, then if you click once back on the page that you're in, the actual pathway or referral page, for example, then on your keyboard, you can press Control F, a search box will then appear, and then you can type the word in. So for example, you can type Lifeline in and then press Enter on your keyboard, and then this will then move through the page, highlight each mention of that keyword, and then you can keep pressing enter to see how many times that appears on the page. This is because we might have the referral information, as Evan showed you, either broken up into regions or sub-regions, or we might have the headings sort of categorized. If it's a large referral page and there's sort of categorizations of services, we might have different subheadings, and Lifeline, for example, could appear in multiple of those subheadings. So keep pressing enter, and then it'll show you every time Lifeline is mentioned on that page. And then if you find that the information that is listed for your service or your organisation has some information that needs to be updated or information needs to be added, then you can use the send feedback button on that specific page and send us a short email that tells us what needs to change, what needs to be added or revised. And if you can use it on each specific page, that's really helpful for our team on our side, so we know exactly which page you're referring to and what needs to change on that page. All right, next slide. Thanks, Evan. And then I just gave you a visual representation here. It's hard to explain in sort of abstract words, so this is sometimes a little bit clearer. So this is a visual representation of those instructions. So you can see, for example, on the suicide risk referral page, if you see on the first image, we've got an arrow pointing to the expand all in the right-hand side toolbar. And then that will expand all of those drop downs, for example, that's on that referral page. Then when you press the Control F on your keyboard and add Lifeline into the search pop-up box, then it'll highlight for you in yellow or orange where it finds that information on the page. You can keep pressing enter and it'll just keep scrolling to each mention of that. And then we've just pointed to the send feedback button, which will always hover at the bottom of each page. And then you can just quickly send us feedback on what needs to be added or changed. Okay, thanks, Evan.
Thanks, Erica. Just before I briefly talk about and summarize the benefits of I guess why we do this and why we have this approach. I just want to, obviously, you know, these last couple of slides may seem complex with regards to updating your information. Lifeline is probably a good example where search results will appear on multiple pages. Don't necessarily see that as a barrier to say, okay, wow, that's a lot of information that I need to update. You know, what you can do is just sort of check the first 2 or 3 and then get in contact with us. And then what we can do is we can assess and say, you know, you might check the first one and say, oh, okay, that information's out of date. You know, we've changed our phone number. We've got a new web address, something like that. Just check the next 2 or 3. And if they're all the same sort of content, what you can do is just reach out to us, provide feedback on one of these pages and just say, look, I notice I'm listed on some of the other ones as well. And what we'll do is we'll actually, behind the scenes, as part of our normal updating process, we will actually go through and check that information regardless. And we will then update the corresponding pages accordingly. Now, obviously, that's going to differ from time to time. You know, if you're Headspace, for example, and you obviously have offices, you know, in Tamworth, in Newcastle, and in between, why you're contacting us may only relate to one of your specific offices. It could be that you know, your Samaritans, for example, as well. Again, it just depends on the situation. And if you're just a specific provider in a very specific area, you may only have 2 pages or 1 page, and that's okay as well. So please don't, when you do a search for your service provider name, don't see the results and feel overwhelmed. It's important that you just sort of check 1 or 2. Reach out to us using that send feedback and just let us know what it is that you want changed or updated or sometimes added to the page, because we are a relatively small team, and whilst we do our best to map all services, we will often accidentally overlook things, and we are trying to map all as I said, public, private, and NGO. So for services. So I just wanted to reiterate that. Now, as part of the overall process, and I guess part of why we do what we do, and why Health Pathways has sort of, I guess, been so successful, and we have done evaluations over the years in the Hunter New England region. It facilitates relationships and collaboration when we're building pathways and compiling referral information, and it builds confidence in the understanding of local options, and it maps the landscape, I guess, so people are aware of what's available, and also of the gaps, and it helps us to identify those elements. It also provides opportunities for local clinicians to provide input into pathways, and also to see, okay, you know, these are the only services that are available to support this particular condition, and it can, in conjunction with e-referral, improves the quality and appropriateness of referral. So when we, you know, sit down for the first time and actually say, okay, what is a service going to see? What's their criteria? What do they need from the clinician, from the GP, to ensure that they can do the best job that they can do? And we document those, and we try to reach an understanding where everybody's happy, to, you know, hopefully share the workload as much as possible. It provides a greater outcome for patient experiences and patient outcomes. Eric is just going to briefly talk about the utilisation of Health Pathways, so I'll hand over to you.
Thanks, Evan. So yeah, we wanted to just show you that the effort that you might put into either adding or updating your referral information into Health Pathways, or if you want to become more involved in Health Pathways and be a contributor in a working group, for example, the result is really worth that effort that you put in. So we do get really good usage of Health Pathways. So Hunter New England is obviously a massive region, and there's a lot of clinical and social professionals practicing in that region. So you can see there, we've just showed you a trend graph from the 30th of June 2021 to the 30th of June 2022, and the monthly usage for both regions' sites. So you can see there on the left, that axis there, there's more than 3,000 users there, and it's reasonably stable, and then there's some peaks as well in usage. So there is a little bit of variability in usage in Health Pathways. There's a trend on all Health Pathways sites basically that there's lower usage on the weekend, obviously because our primary audience is general practice teams in general, and primary care providers a bit more widely. So generally they would be working a little bit less over weekends, and then generally also in the summer holiday period over Christmas and New Year, there's definitely a drop in usage. But during the year, it's reasonably stable, but then there can be small peaks, and that could be particular things that are happening in a public health sense. For example, the pandemic, there might be quite a big system change. For example, new drugs are added to the PBS, for example, the COVID oral antiviral medications. When they're added to the PBS and GPs can prescribe them for their patients, we will see a peak in usage of the COVID related pages specific to management of COVID and how to prescribe appropriately those antiviral medications. So that's just an example of some of the peaks that might happen in usage. And then on the Central Coast, you can see there's between sort of 400 to 600 monthly users as well on average, and there's some little peaks as well in usage and some little troughs depending on the time of the year. So that just gives you an overall kind of summary of the number of users per month that are using Health Pathways. We use Google Analytics to obtain this data, and that just gives us the number of users. So we can't actually tell whether that's a GP or a practice nurse, an allied health professional, or a mental health professional, for example. We can't actually pinpoint that. All we can really say is that's a user. But that just gives us a really good indication of the uptake and usage of HealthPathways. Okay, Evan, do you want to pop to the next slide?
So we're just going to have a briefly touch on the public-facing aspect of the Health Pathways work that we do. So everything that you've seen so far around, say, the clinical pathway with things like the assessment, the management, and the referral, that's for clinicians and the service providers themselves to and allied health professionals to see. But as part of those pathways, we also attach resources. One for the health professional. So we have, it might be a further reading section for health professionals. And we also have in the pathway a for patients section. So when we develop a pathway, it might be social isolation and loneliness. It might be a suite of pediatric pathways, for example. We will actually, as part of that working group, sit down and say, okay, what kind of resources, are people frequently giving to patients, or what type of education do you think would be useful for them to read and become aware of to help them and to help you, when delivering the service, and whether that's as a commission service or a GP or in the hospital setting. And that's what patient info is for. We extract the information, pertinent information out of those pathways, and sometimes also the referral information as well, particularly if clients or patients can self-refer into a service. So drought, so the disaster and adverse weather event, we did a drought support pathway, and it had a lot of self-referral services. So we almost did a like-for-like extraction of that information and put it into patient info, so people could access those services and be aware of what was available in the community. So we're not trying to, I guess, replace anything else that's out there. We just sort of see it as an opportunity to share the information that we have, particularly when it's off the back of something that's sort of so widely developed around not only our own Central Coast Hunter New England region, but more broadly across the state. We have state pathways and also right across Australia as well. So obviously, this is a screenshot of what sort of patient info looked like for a lot of the last 2 years. As you can see, a lot of these feature topics, they're all COVID related. And basically, where can I go to get testing? So you can click on that. It might be vaccines, it might be disability info, etc. So we do have 2 patient info sites, one for Central Coast and one for HNE, but by and large, the content is almost identical, if not identical, across those. So again, the table of contents on the left-hand side, you can see, just above the assault or abuse that's in red there, you can see things like the drought support, bushfire information, flood. What services are available? So it's not there to say, your river is peaking at 5 meters. It's there to say, okay, if you're needing some type of care, what kind of healthcare services may be available that relate to those particular type of situations, and what can you do to get help, more importantly. We also have things like planning for end of life. You can see that down on the bottom left-hand side, 4 up from the bottom. Things like drugs and alcohol, refugee health, sexual health, etc. This is the mental health. So just diving into some of these pages a little bit more detail. You can see under the mental health, we have information for things like anxiety in adults, problem gambling, suicide prevention, etc. So and youth mental health. We also have a great e-mental health online resources. So what services are available that people might be able to access whilst they're perhaps waiting to see, a psychologist or a counsellor or a social worker? So, what can they perhaps do in their own space and time that is supported online? And then when you actually look at these pages, so this is mental health, emotional and social support. So this is a oldish screenshot, but here we were linking to things like the drought support program, the RAMP services, and over on the right you can see that e-mental health online resources. So it might be around grief and loss, family and friends of people with mental illness, OCD, etc. Now, all of these resources, we, as part of the team, we assess the resource itself, and we actually push those through an assessment tool that we use to check for patient readability, basically. How easy is it to understand, and is it clearly set out, be it formatting and language, etc., to ensure that the literacy level is an appropriate target for the audience in mind, and we then try to identify peak services that potentially produce that information where possible, but also local services as well, including things like the LHD, the local health district. I'm just going to hand back to Erica just for a final summary, I guess, of what we've spoken about today, and the key takeaways for you as commission service providers, and how you can help us keep Health Pathways up to date. And then we've gone through it pretty quick, which is great. So we'll have some time at the end for questions as well, and looks like there might be some of those coming through. So I'll hand over to you, Erica.
Thanks, Evan. So yeah, we're really appreciative of the opportunity to present Health Pathways to you, and thanks to Amanda and Rebecca for organising this and asking us to speak. We'd really like more involvement from commission service providers into Health Pathways. So as we discussed before, you can always at any time use the send feedback button at the bottom of each page on Health Pathways. So we welcome that continuous, regular feedback from you, and we will respond as we can, as appropriate. So we just want to encourage the usage of that on an ongoing basis into the future. As we said, we're really keen for your referral information, either if it's not there already in Health Pathways to be added, or if it is there to make sure that it's up to date. And then if things do change, if there's a change in your service, your referral information, contact details, your criteria, or how a GP could contact you for some advice about the service, anything related to the service. We're really keen for that detailed information to be on Health Pathways, so that we're trying to improve that communication between health professionals and improve that referral process, and so that ultimately the patient gets the best journey through the health system. And then you can also become involved by joining one of our working groups. So as Evan explained, when we're either developing new pathways or doing full reviews and updates of existing pathways, we work with the subject matter experts, and we would welcome your expression of interest to us if you're interested in becoming involved in a working group and contributing your expertise from your profession. And we regularly run different topics throughout the year, so we're either doing full reviews or new developments in lots of different clinical topics across lots of specialties, and we would really welcome your involvement. So if that's something you're interested in, you can do that through the send feedback button, or we've got a couple of slides coming up next. Excuse me, how you can find our contact details on each site. and you can just contact us directly, either through send feedback or our other communication methods like email or phone, and then we'll endeavour to bring you into more Health Pathways work. So this slide just shows you some examples of where you can find our contact details. So on Central Coast Health Pathways, there's a contact us page. You can either find it through the, in the top left, the top right, there's 3 little dots there. If you click on that, that expands that little pop-up box, and there's a contact us link there. Or you can just search for contact us in the search field, or in the table of contents you can find it in the About Health Pathways section, and then click on contact us. And then there's just our team email address as well at the bottom of that slide. And then for HNE, it's the same. If you want to just pop to the next slide, Evan. So yeah, it's the same contact us page on HNE as well. So you can use the search bar for that, or in the table of contents. Very similar between both sites. And I think that's our last slide. So I think we can open up for questions now. I think Sandy will return back to us and she'll be able to ask us the questions.
Thank you so much for your presentations, guys. That was really excellent, very comprehensive information around Health Pathways. So much so that we actually only have one question so far in the question panel. It's from Ronnie, and I think this is relating to the analytics. Could you tell the difference between people changing and updating their own information or people accessing to make referrals? Okay. Yep. Go, Evan.
We'll probably both provide an answer because we both do this. In a very literal sense, no, the Google Analytics doesn't. It's at a relatively high level. So in a simple sense, no. The longer answer is yes, we can through trends and finer nuances between the data. So when we look at information and we correlate that with things like an internal update, for example, when we do reviews, for example, so we might see a very large spike and that's because we have been we've had a suite of people doing a review on a pathway. So pathways are generally formally reviewed every 2 to 3 years, and we do things like what's called a partial update to pathways themselves. So the longer answer is yes, we can, but we do that via analysing trends across a longer time period.
I might just add in that we can look at the usage of particular pages on Health Pathways. So with Google Analytics, we can search for how many times a user has looked at the suicide risk referrals page, for example. So that will just give us an idea of the whole page. So as a commission provider, there might be 4 or 5 different commission services on there. There might be LHD, suicide prevention programs, and so on. So we can see as a total how many times that whole page is accessed. We can't see sort of individual clicks on how many people are looking for the Lifeline referral information, for example, but we can see it as a whole, that whole referral page. And Evan, while you were talking about the patient info, I thought there might be a couple of things that I could add to if we had time. So maybe if we flick back to a couple of those patient info screens, and I'll give a little bit more detail as well. So we don't actually have any of the little icons on here to show you, but once you log into the sites, on pages where there's content which is specifically designed for the Aboriginal and Torres Strait Islander community, or information that's suitable for culturally and linguistically diverse communities. So for example, translated information in different languages. We've got a little icon of the Aboriginal and Torres Strait Islander flags. There we go. Thanks very much, Evan, for doing that quickly. The Aboriginal and Torres Strait Islander flag icons, or the culturally and linguistically diverse icon, which is just a combination of a whole lot of international countries' flags. So that's a really quick way for you to find specific information to cultures. And those appear on both Health Pathways pages and on patient info pages. So that's a really quick trigger for you if you really want to look for some information specifically to clients that you're seeing from particular cultural backgrounds. That might be really helpful for you. So Evan's just going to show us some information about how it looks in Health Pathways. That's great. Thanks, Evan. And then you'll see the little flag, and then the information is embedded within those drop downs. And as Evan said, we often link to external resources. So if there's a peak body or an organisation that already produces really great resources, we will just link through to that page on their website or to their whole website if their whole organisation's website is based on that service, for example, the Multicultural New South Wales Language Service. And similarly, so in both Health Pathways and Patient Info, when we're working to either develop the information or do full reviews and updates, as Evan was saying, we work collaboratively with lots of different clinicians and subject matter experts, and we have clinical editors on our teams as well. So all of us collectively check that information, and it's checked for that it's reputable, suitable for, for patient education information, for example. So it's curated so that you can rely on, if it's published on Health Pathways or it's published on Patient Info, it's reliable, reputable information that you can share with your clients. So yeah, just wanted to sort of flag those couple of extra bits of information, particularly about patient education. So we will either link through to peak bodies that already provide that information, or if there isn't that information available, we will work locally to develop or collect all of that information, screen it and make sure that it's all appropriate before it gets published.
If we don't, Sandy, do we have any more questions? I was just going to mention one or two more things.
You don't have any more questions, so I'll hand over to you, Evan, to do that. But before you do continue, I just wanted to mention, Amanda did put in the chat that for the commission service providers, that the login details for Health Pathways can actually be found in their provider toolkits. So that's another place for you to actually find the access there. All right, thanks,
and
Evan.
For those that don't have a copy of that, that's available on the Launchpad in Folio and on the PHN website. So
thanks, Andy. Thanks, Amanda. I just wanted to briefly mention that whilst we do typically link the referral pages to the clinical pathways themselves, we do also have this service directories. So at the bottom of the table of contents on the left-hand side, we have service directories, and in here we have a link to the allied health providers, and we also have a link to specialists, for example. So that's another handy way of being able to directly access service provider information. And the final thing I'll mention is that by all means jump into Health Pathways. You can't break anything, so please, we encourage you to have a look around, and whatever might pique your interest. When you look at particular pathways, so this is HNECC pathway, for example. If I compare that to this pathway, which is yellow and says page not yet adapted for Central Coast or HNE, these are clinical pathways that have not been developed for our regions yet. The clinical information is by and large still relevant, but the referral processes are not in place to support these. So if you do see one of these pathways, as I mentioned, we do have over 300 of these, and we are constantly developing pathways for all of these categories. But if you do see one of these, or you think, oh, okay, the service I'm providing isn't necessarily captured in full in Health Pathways, that might be why, but by all means, please reach out to us. because we can either add that to our development list or you know, make a note of it to say, okay, this is something that needs to be added when we get to that stage. So thanks, Sandy.
And Evan, I might just add on there, do you want to expand a drop down again, and we can just show the difference between localized versus unlocalized in the color coding of the table of contents. So hopefully people can see it on the screen, but when you actually log into HealthPathways, you can easily see it. So the ones that appear in the table of contents as black, like acne, that will mean that it's localized. And then when Evan clicks on it, as you saw, it's a white background, and that's been localized for the HNE region. Whereas if it's that light grey colour, which is the next one down, the corns and calluses, if it's light grey in the table of contents, that means it hasn't yet been localised for the region of the site that you're in. So that's just a quick way if you use the table of contents to see what's been localised and what hasn't. And as Evan was saying, so these non-localised pages, they will be Canterbury District Health Board pages. So the Canterbury region pages that when we start Health Pathways and join the Health Pathways community, we get the Canterbury pathways. So as Evan was saying, the assessment and management information will be very similar between Australia and New Zealand. So for a GP, that still might be useful information in assessment and management. They might be using it still with a caution that it's up to their clinical judgment as to whether it's appropriate for the Australian context. But the referral information, as Evan said, won't be useful at all at this stage. But if you come across a referral page or clinical pathway or any page in Health Pathways and you think that's really needed, we really need to localise that for our region, just send feedback on that pathway or that page and just say, you know, what organisation you work for, what your role is, and just tell us you think that that's a really important topic for our region and you'd like to see that localised. And you can also let us know there if you're happy to be a subject matter expert for that topic, if it's relevant to your professional practice. And then, as Evan said, we'll log that in our system, and then we'll work to develop that in the future. So we've got work plans and prioritisation processes that we work on with our partner organisations, the LHDs. And then based on feedback from our users, we can take on board feedback about, you know, prioritising things up the list if there's a real need to localise that information.
Fantastic. Thank you so much, guys. I don't have any further questions in the chat box, but since we have a couple of minutes, I did want to invite anybody who's brave enough to unmute themselves if they would like to ask a question directly. Just give you a minute to find the unmute button.
And maybe while we're waiting, Evan, do you want to just go to the home page? Sorry, I'll just do something on the fly. And we'll just point to
Central Coast or Hunter, New England.
No, Hunter, New England's fine. We'll just point a few things about the home page. So probably the most useful kind of component, I think, of the home pages are the pathway updates sections. So that just shows you either if there's a new page that's been developed for that region that are shown in the green little shortcut there, or if there's been an update to that page. So yeah, Evan's showing you there. There's a couple of new ones that have gone live on HNE in the last little while, and there's some that have been updated. And as Evan clicked through there down the bottom, that hyperlink goes to a different page called More Updates. And this is a summary of all of the changes that have been made over the last probably 6-month period, for example. So you can click through to that and see a summary of what's changed on either an existing page that had either a full review or a partial update, what's changed, or if it's a new localization, there's one there for zoledronic acid infusion, what local information or local edits were made. And as Evan was saying, we're part of a Health Pathways community, and when we do localized pages, we will often adapt from another region's page, generally an Australian or New South Wales region page, but sometimes a New Zealand page if there isn't an equivalent Australian page that we can localise from. And then our team adapts with the subject matter experts, adapts that information, and you can see there what has changed in that either localisation or review and update. And then you can have those hyperlinked as well, so you can click straight to that page as well. So that's a really useful way to see what's changed recently in each Health Pathways site. And as Evan mentioned before as well, if you practice or your clients live or work in regions where there's a cross-border kind of flow of patients, for example, the Central Coast region and the Lake Macquarie region, or the Queensland border up in New England and over the border to Queensland. As health professionals, you can get access, you can request access to multiple Health Pathways sites. So if you see clients who might be travelling to services across the other region, in a different region from where you mainly practice, you can have access to both the Hunter New England site and the Central Coast site, or other bordering regions for our area. So just contact us if you need that extra access to a different Health Pathways region site.
Fantastic. Thank you so much, guys. I think we might bring this to an end, and let me just say thank you very much to our presenters, Evan, Erica and Amanda, for today's session. It was great to actually see Health Pathways live, Evan, so I think my recommendation would be to get onto the sites and play with them. That's the best way to see how to use the site. But we will have this recording available and the slide deck available on the Education Library website in a couple of days, so you've got that. Just a final reminder, please do the evaluation so that we can monitor the quality of these events for you guys. And with that, I'd like to say thank you very much and goodbye.
Thanks, everyone.
All right, thank you very much.